All right. Hi, everyone. Hello, Facebook friendly faces. How are you tonight? What is it? It is Wednesday night. And here we are again for another episode of My Baby Experts.
Hello, Facebook friendly faces. How are you tonight?
Hold on. All right, there we go. Okay, thought I had it all handled, and I forgot one step. But I am actually, hold on, Joe. It didn't come up. Okay. So yeah, here we are struggling with our technology as usual. We are on a new platform tonight, so everybody bear with me as I get used to a new interface here, new buttons, new controls. You know, it's not easy. I'm actually doing it all at the same time. So if you see me struggling for a moment, I'm trying to figure it all out. But here we are for our Q&A. It is actually episode, and I wrote this down. It is the My Baby Experts episode number 125. 125, woohoo! So I want to see some hashtag 125 coming across the screen here. And I can't see you guys yet because I'm still waiting for my handy dandy Mr. Joe over here to get me my phone. But I'm assuming you're all logging on. Oh, there you are. Okay, thank you, Joe. Yay. Okay, yeah, here we are. Hi, everyone. So we are here tonight for our next Q&A, and I'm so excited to see all of you. I am here with a very, very special guest who has been with us before, and she's a great friend of mine and an amazing partner. And this is Laura Kardos from Back Buddy. Hi, Laura.
Hi, how are you?
Oh, so good. So good. I love having you on with me, and I'm just so happy that we get to do this every once in a while where we can jump on and talk to everyone. So everyone's jumping in right now. Let's give them a minute to come in here. Tonight's Q&A is all about pregnancy and birth and really anything else that you guys want to ask us. So feel free to go ahead and post throughout the stream tonight. We're just like laid back, as you can see. I am laid back on my back buddy back here, as always, on my cozy couch with my back buddy. So tonight we're going to answer your questions about pregnancy, childbirth, answer some questions that came in that you guys posted. And then if you guys want to post anything into the stream, I can see you right here. So Jillian saying she loves her back buddy. Awesome, Jillian. Yeah, I love mine too. I love mine too. We have them scattered around the couch here, and we use them for every single thing. Hi. Yeah, okay, let's get some hearts going across the screen. Let's get started with tonight. Tonight, we also have, so we're going to have some prizes tonight. Should we tell them about the prizes to get started?
Yeah, definitely.
Okay, so we've got prizes. Tonight's live stream is actually partnered and sponsored by not only Back Buddy, but also another amazing company that you guys have heard me talk about a little as well, which is Bloom Life. And Bloom Life is going to be giving away a prize as well as Back Buddy. So somebody will be winning their choice of a Back Buddy. And also some lucky winner is going to win a 2-month free rental of the Bloom Life, which I will talk to you about in just a moment. Yes, okay, so I can see they're already posting questions, Laura. They're already posting questions. Excellent. So let's get a hashtag 125 and let's find out where everyone's from too. I want you guys to tell me, where is everyone from? I have been hovering around 100,000 followers for the last few weeks, and we have moms from all over the world. And I've been saying this, you know, Laura, I've been saying like moms from everywhere. And the other day, I just was like thinking, okay, let's get some selfies going. And everybody blew me away. The selfies started to come in. Did you see that post?
Yeah, I did.
There were people from all over the world just taking pictures of themselves and their babies. And I was in tears just reading them. I was so excited seeing everyone's faces. And it was just like this, I don't know. I just got this feeling of like complete hope for our world, like that here we are. And it's like the one thing we have all in common is to talk about this. So yes, everybody's coming in from all over the country and the planet. Okay. Yes. Yay. All right. So let's talk a little bit, first of all, about, I want to give you my background because Many of you guys know me for breastfeeding. I mean, we talk so much about breastfeeding. We talk so much about pumping when I do my Q&As with Jamie or my lives with Even Flow. But a lot of you guys don't know my background or where I spent most of the years in my education and then also in my career. And so I have been working with moms and babies for over 25 years. We're going on 28 years now, okay, of working as a labor and delivery nurse where I took care of thousands and thousands of moms and babies in labor. And then also as a certified nurse midwife, which is where I had my private practice. And I delivered over 600 babies in my practice in those years. I did that for almost 10 years before I became an IBCLC, before I had my learning center and retail store in New Jersey, which a lot of you guys were customers or students of mine here in New Jersey as well. And so the majority of the time that I have been working with new parents has been in the aspect of pregnancy and birth. And so whenever we can get an opportunity to really talk to you, answer questions and talk about pregnancy and birth, this is an opportunity where I can really support you. Now, I love to bring Laura in on these conversations because Laura, too, has a background in pregnancy and birth. So why don't I give Laura the moment to go ahead and tell them about yourself and what you've done.
Sure. Well, this is a topic that I hold very near and dear to my heart because I taught childbirth classes for about 10 years, and my kids are a little bit older now, and I don't get to see all of the babies anymore. And that was one of the best parts about teaching and being a doula, is that I got to be a part of all of that. I get to, meet with these families who are just starting to embark on this new journey of parenthood, and they have so many questions, and it's a very, very cool experience to be a part of that. But being in that field and teaching childbirth classes for so long, I learned a lot during that time. As you know, you're probably still learning, and Shari is an amazing resource to have. I don't have nearly as much knowledge and experience as she has, but what I do have is, my own experience and the experience from teaching classes for so many years, and that was kind of what brought me to where I am today.
Absolutely. Plus, Laura's a mom too. I'm a mom also. So I have two daughters that I had 2 vaginal deliveries with and breastfed. And so we have our personal experience as well. Laura has a little bit of different experience having had twins, but go ahead, you could tell them about that too.
Yeah, well, just long story short, I have twins who are 12 and my youngest is 7. And the twins were born a little bit unconventionally, I guess you can say. The first one was born naturally without any pain medication at all. And the second twin was born by cesarean. So I got to experience everything firsthand right from the very beginning. And so that was actually one of the things that prompted me to start teaching classes, because I felt like there was so much that I didn't know going into the process, and so much that I could share with other people.
Yeah, no, it's so great. Somebody asked, what's a back buddy? I'm going to let Laura answer that question.
Okay, I will answer that question. A back buddy is a support pillow that I designed specifically for pregnancy and nursing. And obviously we find that we use them for a lot of other things too. It's something that will go with you far beyond pregnancy and nursing. But I had such issues when I was pregnant, and then when I was breastfeeding, I felt like there wasn't anything that had enough support. And so my husband is a chiropractor, and I decided that I wanted to design this pillow that would provide the right kind of support, so that when you're nursing, it has the lumbar support, it has support on the sides, it has a little bit of support behind the arms, so that when you're holding a baby, or even if you're sitting up in bed reading a book or working on a computer, your arms aren't dangling to the side. But it has that upper back support, lower back support, side support, arm support. And then the deluxe pillows have the removable slip cover, so they have pockets and a handle, and you can actually unzip the cover and throw it in the washing machine, which I thought was pretty cool.
They're awesome. They're just awesome. And everyone I know who has a back buddy just absolutely loves it. They feel amazing. They're so soft. They're so well made and comfortable. And also the foam that's inside them is all non-toxic foam, CertaPure certified. And so that's super important too. And you really need to keep that in mind when you're thinking about anything when it comes to pregnancy, breastfeeding, to make sure that that foam is not off-gassing, and there's toxic chemicals in so much of this foam. So that's something that I just love about your product, Laura, is all the thought and the safety that went into it as well.
Yeah, that was something that I took very, very seriously when we were designing it, was finding the right suppliers. We make the foam here in the US. Everything is poured here in the US, and the foam is certified, like Shari said, to be made without any CFCs, no phthalates, no harmful emissions, no formaldehyde, no PBDE flame retardants. There's so many things that we're exposed to during pregnancy and beyond that. We really don't want to be breathing in toxic fumes, especially if you're going to be spending a lot of time near it, sitting in it, feeding.
Absolutely. Absolutely. And that really is so important when you're pregnant and after, or anytime, but especially when we're talking about exposure for our babies. Let's just, before we get to the first question, let's talk a little bit about Bloom Life. And Bloom Life is it's a very unique product. This is it right here. It comes in a little box, okay? And this is the first wearable, portable contraction monitor that you can actually put on. It has this little piece that clips on, okay? And so you put this, you put this little tapes onto your belly, and then this thing goes on, clicks on here, and then what it does is it can pick up contractions and goes right to your app, so that it can help you to figure out what's the normal patterns for you, because it can be worn not only in labor, but it can be worn throughout your pregnancy. Like maybe most people get it in the third trimester for a few months to just give them that reassurance of knowing their body, of understanding what's going on with their body. Sometimes people get it because they've had preterm labor in the past and they want to monitor that. But a lot of times moms will get this for their first pregnancies, just to get an idea of like what's happening, whether, it'll pick up Braxton Hicks, it'll also pick up contractions. And, I'm usually one that talks about less technology, that usually says, pay attention to your body, you don't need these extra things. But what I love about this is it kind of gives you the ability to kind of forget it. And you are going to have to communicate those things to your practitioner. And for a lot of moms, they're, wondering, is this it? Is this labor? Am I feeling something? I'm not sure. If I feel like I just have to pee, because sometimes that's the feeling, and yet you're having a contraction. And so what I love about the Bloom Life monitor is that it's one of those things that can help you to kind of focus on yourself rather than focusing on a watch or focusing on the clock and everything else in between. It's totally safe. It's totally, it's not using any kind of ultrasound waves or anything like that. So it's safe to wear, and they are also, rentals. So we're going to be giving away one of those as a prize tonight. And I do have a video that I'll show you in a little while, but let's move on to the first question. Okay. And there's so many questions that are coming in tonight. Look at this. Fantastic. Okay, great. So the first question that came in was from, who is this from? This was from Rebecca Grace. And Rebecca asked the question about, she has scar tissue from previous delivery tears. And she's asking about perineal massage. It's still worth trying. She's 37 weeks. When's the best time to start? And somebody else asked the same question about perineal, tearing during delivery and how to prevent that. And, I've done a lot of births, and so I will tell you my opinion about perineal massage and then some facts and stuff that you might want to know about it, like what's good to use for that. So perineal massage is a way to actually massage the perineum throughout your pregnancy. It's something that you could do daily. You could do every couple days, starting, anytime in the second to third trimester. It's something that you could do on yourself. It's also something you could do with your partner. And what I found is that perineal massage, it's not so much going to stretch the area out to prevent tearing. That's not really what I found. What I found is that it helps you to get the sensation and the feeling of stretching that area of your body, that perineal area, so that you can have a more controlled delivery. And when I say controlled delivery, that means that you start to get used to that feeling of that stretch, so that when you're in that moment of pushing, when that baby is starting to crown, when you're actually going to give birth, the area is that feeling of stretching is something that you've felt before. It's something that you've practiced. It's something that you've learned how to relax through and breathe through. And because of that, you can deliver more slowly. What really does prevent tearing is having a slower, more controlled delivery, and sometimes also the position that you're in as well. So being more upright and doing it slowly will help to prevent tearing. You can deliver without episiotomies. You can deliver without tears. That part of your body, the perineum, the vagina, the vulva, that is meant to stretch like that. And so perineal massage can really help with that. Last year, I worked with Joanna Ellington, who's a researcher who makes a product called Baby It. And we worked together. We actually did a show together back in, I don't know when that was, in February or something. We talked all about this, and I actually co-authored her article with her. And she did a lot of research on perineal massage and what's good to use. And I think some of the things that you need to keep in mind is that some of the most common things that people use, like KY jelly, Astroglide, those are not meant for perineal massage, and they can actually cause the tissue to, it's not good for the vaginal tissue. So I want you to be really careful about what you use. People will use things like oils that can actually cause infections because of the rancidity of the oils, or even coconut oil, where people think, oh, this would be a good idea. That can actually impact the moisture in the vaginal tissue as well. So from her research, she found that those are not really great uses for, not really great mediums for using for perineal massage. And so that's where she invented that Baby It. It's more of an isotonic gel and liquid that it works great on the vaginal tissue, doesn't increase the risk of infection. So I would say doing that to using perineal massage as a way to practice the stretch, and use it as a method to speak to your provider. You know, if you're working with a midwife, it's a great conversation to have, because it's a way to bring up the idea of, like, I'm really trying to deliver intact. I really don't want an episiotomy, and even bringing it up with your doctor. So these are all good conversations to have beforehand. And typically, if you're seeing a midwife, that is their philosophy as well. So they're going to help you along the way. Somebody's saying here, Rebecca, I was told vitamin E oil, is that not recommended? Vitamin E oil is actually not recommended. I'm going to give you a link. Joe, do you have the link for the article? It was a paper that we wrote together. I'm going to link that here so you can read all about perineal massage, what are the best things to use for it, and why not to use these other things, because she did a lot of research. And I know even I was thinking these oils were fine until I started reading about what we didn't want to use. So Joe's going to go ahead and post that link for you guys. Okay. Yeah. Not vitamin E either. So good question. And you know what? Rebecca also asked, Rebecca. Okay, great. There you are, Rebecca. So that was your question. So Rebecca also asked a question regarding what's the latest on eating? Last I delivered was 2014, and there was no food during labor. Recently, I'm seeing conflicting reports. And I'm thinking that, Laura, that would be something good that you can kind of take.
Sure. So the stance was always that they didn't want you to eat or drink during labor, because if there was ever an emergency and they needed to use general anesthesia, they worry about the patient aspirating anything that's in their stomach, which is a real concern. Now, you know, there's generally a pretty small percentage of people that have to go into an emergency C-section, you know, not knowing that that's going to happen ahead of time. But it does happen. So depending on where you're delivering, a lot of times if you're in a hospital, they will still continue to limit what you can take by mouth. They'll usually let you eat ice chips, clear liquids to a certain extent, but depending on where you're delivering. Now, you do obviously need strength during labor. A lot of people compare going through labor to like running a marathon.
Yes.
So if you're not hydrated and you don't have the nutrition that you need, you're going to start to lose energy. So it is important. I always tell my students to eat up until the time that you go to the hospital, or eat what you're comfortable with. Obviously, don't have like a super heavy meal like before you go, but just eat little bits to try to keep your strength up. And then depending on where you're delivering. Now, the American College of Obstetrics and Gynecology, I believe, still reaffirmed what they've been teaching in the past. It was reaffirmed in 2017. So they still are taking the stance that only clear liquids during labor, because they don't want anything in the stomach 6 to 8 hours before, if you had to have general anesthesia. But again, a lot of that will depend on your provider and where you're delivering to, and what their rules are.
Yeah, it really comes down to like who's taking care of you and where you're delivering. And,
right.
It's unfortunate because so many women are in labor for long periods of time. And like you said, they really do need that nutrition. It's hard to labor for days without eating. And it really does come from a pretty antiquated approach to birth, so
right.
That's one of the reasons why it's good to stay home as long as possible too. If you are having a hospital birth, stay home, eat, drink, eat lightly. I always used to tell my patients, eat what would be not so horrible coming back up, because often you can vomit in labor. And so you just want to stay hydrated. You want to stay give yourself energy, make sure you're eating, but then eat lightly. Don't go nuts. Don't have like gigantic meals. You're not going to want to anyway, probably. You're not going to want to anyway. Someone's saying that their stream is frozen, but I think it's just her. I'm sorry, Maggie. Yeah. Okay. Everybody else is doing okay. All right. Awesome. Let's show the video for Bloom Life. I'd love to show this video. And remember, tonight, if you want to win one of the prizes, which is Bloom Life 2 months free rental, the Bloom Life monitor, or the Back Buddy by Mom's Essentials, you need to like or love this post. You need to comment here during the stream and tell me what you love about both products. And then you also need to register. There's a link in the post here. It's mybabyexperts.com/FB Live. And, I just want to make a comment because you need to register. Even if you've registered for the last live stream, if you want to win the prize, you have to register again each time, because we do use that as one of the eligibility requirements. So if you register, just go back in and register again. You'll see that you come to that same page where it says to enter again. So that's how you win. So I'm going to go ahead and share my screen and show you guys the video. Hold on one second. All right, let's see here. Can I do this? I think I can.
These are your first moments of motherhood, filled with joy, curiosity, and love. And questions. Lots of questions. We're here to help. Introducing Bloom Life, the first and only wearable designed for pregnancy. Part gestational guru, part pregnancy decoder, Bloom Life automatically detects, counts, and times your contractions in real time. No more guesswork. Designed to be worn throughout the third trimester, Bloom Life translates those strange pregnancy sensations to provide a validated second opinion on what you're feeling, conveniently from home, giving you easy to interpret, easy to share information at your fingertips. This is all made possible by a lightweight, clinically validated sensor that safely and accurately measures the electrical activity of the uterine muscle. Because it's 100% passive, Bloom Life is safe for continuous use day or night. Simply snap the sensor into the patch and comfortably stick to your belly. With automated tracking and counting, quickly see what's going on from a glance. Revisit past recordings to learn how your contraction patterns are changing. See, for the first time ever, how your body is preparing for labor, and that special moment when you'll meet your little one. Because that day is right around the corner. This is the future of prenatal care. This is Bloom Life.
All right. I love that video. So cute and such a great invention. Technology's getting better and better. And so if you want to win, like, love this post, comment here, tell me why you need it, and make sure that you register. Okay, let's move on to some more questions here. We've got quite a bit to cover still. This question came in from Carrie. I think I saw Carrie in the stream tonight. I'm not sure, but I think so. Carrie said, hi, Shari, was wondering about some natural remedies for preventing or treating postpartum depression or baby blues. I've read about placenta encapsulation, but it's a little expensive. Do you know what would be a good alternative? And so, yeah, let's talk about that a little bit. You know, one of the things that, you know, when it comes to the placental encapsulation, a lot of people talk about it, swear by it, you know, do it and feel like it's really, really helped them. There aren't a huge amount of, there's not a lot of research on it. There's not a lot of studies on it. So it's kind of an unknown. It's something that, you know, we probably do need a lot more research to really make any kind of claims about. But other things that you could try, you know, make sure that you're getting enough omega-3s and, you know, the fatty acids. Those are going to really, really help with the blues. Remember, there's a difference between postpartum blues and postpartum depression. And we actually are going to have a show coming up. When is it? On the 15th, I believe. I don't remember. I wrote it down somewhere. I have a show coming up with Dr. Diana Barnes and Lindsay Gerst on, I wrote, oh, here it is, on the 18th. Okay, on the 18th, we're going to be talking about postpartum depression screening again. But the blues are something that, you know, many women are going to experience after birth. And what that is just a huge fluctuation in your hormones that just make you feel like you just want to cry. How many of you guys have actually experienced this, what I'm talking about, that feeling of just those blues afterwards where you're just feeling like everything feels emotional. You come home with that new baby. And remember, it's just a time when you're exhausted. You've just gone through what Laura described as a marathon of labor, or, you know, and your delivery. And then, you know, you have those blues. It's totally normal. And there's a difference between that and postpartum depression, which we're going to talk about a little bit as well. But making sure that you have enough of those omega-3s that really can get depleted during your pregnancy. So that's one thing. Making sure you're taking, and there you could either take it through a supplement, and there's also foods that will help that are high in omega-3s, like flax seeds, chia seeds, salmon, sardines, and other types of oily fish. Those are all going to be high in omega-3s. So you can either do that through a supplement or increase your diet as well. There's also, you know, other ways, like, you know, making sure that you're taking care of yourself, making sure that you are taking a shower, that you are getting some rest. And it's so hard with a new baby. I know I'm sitting here saying get rest, which is not easy, but you do need support, which means that when they talk about that cliche of sleep when the baby sleeps, it's not a cliche. It's really, really important. It's going to be important for your recovery, your postpartum recovery, but also for preventing, you know, maintaining your milk supply, keeping your sanity. Is, you know, sleep deprivation is a form of torture. So we really want to make sure that you're getting some rest, and sometimes just putting other things on hold so that you can really take care of yourself, get some fresh air, step outside and get some air, set realistic goals for yourself. These are all ways to deal with postpartum blues, and realize that it's going to pass. If it starts to get worse, where you feel like you're moving out of blues into something worse, which would be more of a depression, where you're actually feeling like you have thoughts about harming yourself or harming the baby, or, you know, anxiety, severe sadness that you just can't get out of, you know, feeling like hopeless and there's just nothing that's making you happy. Those are different signs where we're moving into the place of postpartum depression. And 1 in 7 women are going to experience that. We're going to talk about that, like I said, in a coming episode again. But I think that it's important to understand that those blues can be normal as well, very normal part of delivery. And then most of all, talk about it. Like, don't keep it to yourself. It's really, really important to share that with your partner, share that with your practitioner, talk to your doula, talk to your midwives or your doctors. Make sure that you're not keeping it to yourself. And yeah, Kate's saying here, support is definitely the key. It really is. So many moms feel so much shame around it. There's so much stigma around feeling sad. It's a time when you're supposed to feel happy and you feel sad, you know? And so it's okay to say it, and it's okay to share it, and it's okay to cry. And yeah, and then just talk so that, you know, you really do have that support and people are there to support you. So let's see, what are these questions? Do you see how many questions are coming in? I don't know if you're watching the screen here, Laura, but there's so many things coming in here. Let me see. What? Oh yeah, you know, Amy's saying here, yeah, you know, she's saying here, I can't link in the moment, but somebody shared recently, and it was me. I talked about this in our private group. I mentioned the fact somebody asked me about placental encapsulation and the possibility of increasing milk supply. You know, there's not been really any research about that. And, you know, I question the idea of possibly the progesterone in the placenta, and could that have a negative impact on your milk supply? I don't know. I think we all don't know the answer because there's no real research or studies that have been done around it. But what I have heard, I got a fly or something flying around here. So if you see me going like this, I'm trying to get it away from me. It's something that they do talk about helping with perinatal mood disorders, depression, postpartum blues. So yeah, okay, let's move on to another question here. And okay, I can't stop reading these things. There you go. Okay. Yeah, you know, speaking of postpartum depression, one more thing. Conchita, I think you're in the chat room here too. She said lately she's found herself losing her temper easily. She gets angry at her oldest son for silly little things. Then she feels guilty for it and finds myself sometimes yelling at my 3-month-old when I haven't had much sleep. Okay, so that's a perfect example of where you really need to be addressing it. You need to be talking to someone. You know, obviously the sleep deprivation is really, really hard. But, you know, this is something that I would not, if you're yelling at your baby, obviously it has gone to a point where you need some support. And so Conchita, please yeah, there you are. Hi, sweetheart. I know you're here. She's always in the chat room with us. And I really want to support you. I want to make sure that you're getting the help that you need. Make sure that you are speaking to your provider and expressing these feelings that you're expressing here with us, that you're talking to someone about it. That's something that it doesn't mean that there's something necessarily wrong. It doesn't mean that you're a bad mom in any way. It doesn't even mean that you have postpartum depression. It just means that you need help, you need support, you need to be able to talk about it, and you need someone to be like supporting you with it, especially if it's because of lack of sleep. And maybe you need to get someone in for a couple hours to get some extra sleep, maybe a postpartum doula, or just having someone like your mom or your mother-in-law or somebody, family member, a neighbor, come in to hold the baby for a few hours in between your feedings so you can get a little bit of extra sleep. You feel so sad sometimes. Yeah, I know. This is, and I want to support you because I know how sad it can feel. I know that it can be really, really difficult, and you don't have to suffer like this in silence. You don't need to do this yourself. So I am so proud of you, sweetheart, that you are talking about this here with us, that you are bringing that out. You're being honest about it. I really honor you for that. So let's give some hearts to Conchita across the screen. I want to see a lot of love coming because it's not easy to admit, you know, this is what's going on. But I can tell you that because you're saying that, so many people here, they're all telling you right now, we are here for you. Yes, I know this community, and you could not be in a better place than with all of us. So yes, and you also need people near you to be supporting you as well. So I'm so proud of you for talking about it. And make sure that you watch the episode that we have on the 18th, okay, coming up, because Dr. Diana is going to talk all about screening. It's National Mental Health Screening Awareness Month, and so she's going to be coming back to talk about it. Okay, awesome. Yes, they're all giving you tons of love. I love that. Yay. Okay. Let's move on here. I would like to, let's see, what's the next question that we had come up? We have a question here from Christina. She's asking about natural pain relief in labor. Laura, I'd love for you to share a little bit about that. You have had so much experience discussing this with your students. Anything that you recommend to do? She said she was going to her birthing class tonight, so she may have more questions. She may have learned some more, but what would you recommend for some natural pain relief?
Well, this is a topic, again, that I've dealt with a lot in the past. Obviously, in teaching childbirth classes, that's one of the things that so many people concentrate on is how am I going to deal with the pain? And there's a lot of different methods out there. There's Lamaze, there's hypnobirthing, there's Bradley. I taught the Bradley method for 10 years. And one of the things that Bradley always focuses on is relaxation. Mm-hmm. So it's different than Lamaze, let's say, in terms of we don't try to distract from the pain, but we actually try to focus in on it and work with it to help your body manage the labor a little bit better. But I would say that whatever method you choose, there is some preparation that's involved. So I think one of the most important things is being prepared, right? Understanding the process, knowing what's going to happen in each stage of labor, because that's going to make a huge, huge difference. And I know in my own experience, I was at a place where I was feeling like I couldn't go on. I remember saying to my husband, I don't think I can do this. I don't know what to do. And I remember him saying to me, because when they had checked me the last time, I was at like 1.5 centimeters or something. And I remember him saying to me, you could be at 2 or 3 centimeters already. And I looked at him and I said, if I am at 2 centimeters, I am not going to make it. Like, I just knew, I was like, this is bad. But then when they checked me, I was at a 7. Now, in my mind, because I had done all of the preparation beforehand, I knew what 7 centimeters meant. And I knew that from 7 to 10 was going to be the hardest part, but it was going to go by really, really quickly. And it was like textbook transition stage. I started doubting myself. I started feeling like I was not in my own body, and there were so many things going on. But when they kind of reaffirmed that, I was like, okay, I can do this. But some of the methods that you can use to actually cope, besides just being familiar with the process and understanding what's happening to you, which I think takes a lot of the fear out of it. There are breathing techniques that you can use to try to get yourself to relax a little bit more. Any kind of tension is going to cause more pain. Pain is going to cause tension, and it just causes a vicious cycle that's really, really hard to stop. So I would say learn some different breathing techniques, learn some relaxation techniques, and practice them. You actually have to practice them before the day of, because it takes a long time to teach your body how to relax. Yeah. But I also think, in addition to just the physical relaxation, because there's different relaxation methods that you can use for physical relaxation, I also think that there's also other types of relaxation. You have to be physically relaxed, but you also have to be mentally relaxed, and you have to be emotionally relaxed. And the mental aspect, you can learn by doing various mental relaxation techniques. Like there's a rainbow technique where you can go through the different colors. There's a technique where you can use where you relax different muscles in your body. You know, at different times, you'll start to focus on one area, and then the relaxation will move. Let's say you start in your toes, and then you move up to your feet, and then your ankles and your calves, and you try to relax. Those are all kind of mental things that help with the physical relaxation. But then the emotional relaxation, to me, is almost the most important, and that is being comfortable with your birth team, being comfortable with your partner, being comfortable with your birth plan, understanding what's going on. And I think when you have all of those things combined, it will help your labor go by faster. It will give you a less painful labor, and it'll just help your body be more efficient in doing what it's supposed to be doing. Yeah. But I could go on and on and on about all of that. I think that there's a lot of different aspects there.
I would add two things, and those are all really, really important aspects. And I loved what you said about the fear, tension, pain cycle. And really, that's such a big thing. And I think we talked about that on our last Q&A, Laura and I together, about the fear, tension, pain cycle. But two things that really work is, one is being upright. Laying flat on your back is going to be one of the hardest things to do when you're in pain. So being up, being able to get into different positions, hands and knees, squatting or walking, all those things are going to help you for natural pain relief. And then the other thing is water. I find that whether you're sitting in a tub or you're just in a shower, for me, I spent a lot of time in the shower when I was in labor because I was too hot to be in a tub. I don't really like to be submerged like that, but the water of the shower, it was like amazing to be able to be in the shower, letting the water just run on my back, letting the water just run on my belly. And that made such a difference for the contractions. And when I was a midwife, and I was delivering babies, that was like one of the things I'd say, go stand in the shower, just stay in there for a long time, don't come out. And that's one of the best ways that I've found to really support and have some natural pain relief. Somebody's asking about raspberry leaf tea. That's not for, I don't know what you're asking about, but it's not for pain relief. That's something that you can actually take during the pregnancy. And this is an herb. It's a tea that you can drink. Red raspberry leaf is a uterine toner. So what it does is it helps to tone the uterus, which means that the contractions can be more effective when you finally do go into labor. It's one of the teas that many moms drink during their pregnancy. It's like a pregnancy tea, and that's one of the ingredients inside of it. So that's red raspberry leaf. And then somebody else is asking, Cassandra is saying, about to have my third baby. I'm 35 plus weeks. I feel so much discomfort all day, and then I can't sleep at night. My belly seems like it's in a constant contraction. Okay, so a couple things I want to say about that, because it's not only for you, Cassandra, but for anybody. One of the things that happens quite often is not drinking enough water. And I'm just going to say that as a blanket statement, because when you're pregnant, you have such a high water requirement. Your body needs fluid for everything. Your body needs fluid to make the amniotic fluid, which is constantly replenishing itself every single day. Your body needs fluid to increase your blood volume, which your blood volume is increasing by 50%. Sometime, around 24 weeks, it's starting and it's increasing tremendously so that you can have that extra blood for delivery, which you will need. So water is a huge thing. And you may be saying, oh, I'm drinking tons of water. I'm drinking 8 glasses a day. I'm constantly drinking. But if you are feeling symptoms of need for water, and they may not feel like your typical dehydration, it could feel like constant cramping. Okay, so it just kind of triggered me when I saw you say you're feeling that constant contraction. It could be that your body's kind of giving you the signals right now that you need more fluid. Drink more fluid, make sure that you're getting a lot. If you're drinking 8 glasses, you may need 10, you may need 12. Everybody has a different threshold to what they need. So, that's something. If you're having headaches, if you're having a lot of swelling, or you're having those constant contractions, make sure that you're reaching out to your midwife or to your doctor. It could be a sign of high blood pressure, preeclampsia, but it could also be a sign that you're not drinking enough. And very often you wind up not drinking enough, you get all crampy, and you wind up having to go into the hospital for IV fluids. To avoid all of that, make sure that you're drinking, okay? And you want to get rid of those, irritable uterine contractions that just wear you out, make you not sleep. And that's what you're describing here, is that you can't sleep at night because the uterus is just contracting and contracting. fluid will definitely help that. So drink. Then you'll just be up all night peeing, but you'll hopefully stop all those contractions. And then pay attention to those contractions. It's one of those reasons why the Bloom Life might be a good product there, because it's kind of telling you whether you're having contraction or not, and then you can go to sleep and stop thinking about it. All right.
Can I tell you a funny story really quickly?
Yeah, go ahead, of course.
Contractions. So when I was pregnant with the twins, I was having contractions all the time. And of course, at first I didn't even know what they were. I was just like, I'm having this tightening and I don't really know what's going on. And my doctor's like, yeah, those are contractions and you need to pay attention to those. Yeah. So I remember being in the hospital one time because I was having so many preterm labor contractions. And they kept saying to me, you must be dehydrated. You must be dehydrated. And they're making me drink like these giant jugs of water. And so I'm drinking and I'm drinking. Well, they had monitors on both the babies and they wouldn't let me go until they had 20 minutes of both babies on the monitor at the same time. I'm like, you're making me drink all this water. I have to go to the bathroom. And the nurses are like, well, we're just going to have to take those monitors off again. And I'm like, I can't help it. You just made me drink all of this. I have to go to the bathroom again. Yeah. So I literally could not get 20 minutes of both babies because I'm like, you have to let me stop drinking.
Listen, those babies are sitting right on your bladder. And it's just like, it's one of those things where you're trying to drink enough to stay hydrated and then you're constantly in the bathroom. Yeah. And sometimes it's hard to drink a lot of water all at one time too, because your belly just can't take in that much fluid at once. So people, my patients would always ask me, like, how do I get all that fluid down? And literally just taking sips, like a sip every 5 minutes, just sitting there, always have your water bottle with you. Just keep drinking a little bit every few minutes is going to help you to get that fluid in, to be able to get that fluid in. Pat's asking you, Laura, how early your twins were, or were they born?
I was able to carry them to 38 weeks and I was on bed rest from 26 weeks on. So at 26 weeks is when we discovered that I was having too many contractions. And I was in and out of the hospital in the beginning there. And then they put me on strict bed rest on medication. I was able to they took me off of the medication around 35 and a half weeks. And I carried them almost another 3 weeks after that, having contractions every 5 minutes.
Yeah.
It was crazy.
Yeah. Yeah.
I was really, really lucky.
You were lucky to be able to go to that point,
Yeah.
We have some offers here too. So Joe posted up here, there's a Bloom Life offer, so that for anybody who wants to order the Bloom Life, it's $20 off your rental, and it's 20 My Baby Experts is the code. The link is there too, to be able to go to their website and get $20 off if you know that you really want this and you want to start monitoring and have it home with you. You can actually order it and put the order in anytime, and and then tell them when you want them to send it out. So you can place that order. And then Laura, we also have a code for a discount code for you too for the Back Buddy. So Joe's going to go ahead and post that, and that's with 20% off, I believe, on the Back Buddy. All right. So Joe's going to go ahead and post that. There was a question that came in regarding, Cara Marie asked a question about if I would do a little bit of information about the different professions of childbirth. She asked me if I could do that one day, but I could talk about that for a minute here. The difference between a CNM, a CPM, an IBCLC, an obstetrician, a doula. What is the difference? Because there's so many different practitioners. Lots of times people get confused of like, what's the difference between a midwife, a doula, an obstetrician? And so, first I'm going to start with the difference between a midwife and a doula, because there is a big difference, and they're usually used interchangeably, but they're not. So a doula is more like a professional labor coach. That means somebody who will be with you in labor. Are you a doula, Laura?
I am, yeah.
Okay, so Laura is a doula and also a childbirth educator. And so it's someone who would be with you, and this is a labor doula. So there's labor doulas, and then there's postpartum doulas as well. But a labor doula is someone who will be with you in labor. They'll usually spend the entire, sometimes, most of the time will come to your home before you actually go into the hospital to labor with you. They don't take the place of your partner, and they also don't take the place of your medical practitioner, which would be more like your midwife. So, you know, that's a midwife is someone who actually takes care of your medical care during your pregnancy, throughout your whole pregnancy, and then also for your birth. That's what I did. And so it was actually doing the birth itself. It's sort of like an obstetrician, but we don't do any surgery. All right. So we do everything but the C-section, and mostly normal, healthy vaginal births and pregnancies. In my practice, I did a little bit more than that because I worked with a doctor. But you can see a midwife through your entire pregnancy. My patients only saw me, then I did their births. They do their postpartum care, and also well woman care as well. So it's not just for pregnancy. I had many, many patients, a big practice where women came to me, you know, in between their pregnancies for birth control, for pap smears, for their regular annual visits, and anything in between. So that's the difference between a doula and a midwife. And then also they're obstetricians, which are doctors, and they also deliver babies, but they also do surgeries too. And, you know, there's also the difference between two different types of midwives, which are certified nurse midwives, and then what we consider CMs, or certified midwives, that are not nurses. And there is a difference in the sense that most of the CMs will actually practice in the home or in a birthing center, not in a hospital setting. So a CNM, which is a nurse midwife, has a degree, and usually a master's degree in nursing, which is what I have. And we practice in all settings, which is hospital, homes, birthing centers, and we also have a license to prescribe medicine. So we can write prescriptions, and we can order medications and do admissions into a hospital. So there's a difference between that as well. I know it can be a little bit confusing. Yeah. And so, and oh, my friend Lisa Palladino, who's also CNM and IBCLC, is in the room. Hi, Lisa. Yeah, Lisa's going to be on with us. So we have an awesome show coming up on the 25th. We're going to be doing a whole panel with Lisa and Dr. Scott Siegel, Michelle Emanuel, Nancy Calmuso, and Jackie Hines, a whole panel on tethered oral tissues. So tongue ties, lip ties, buccal ties, and a whole panel of the most amazing experts. And Lisa's one of them, and I think she's here because Joe's saying hi to her. So that's on October 25th. You do not want to miss that show. It's going to be so, so good. I'm probably going to be announcing it this week. I'll be putting up all of our events for the whole, I think I have the events all scheduled out like from now until the end of November. So I'm really ahead of the game finally. And I'm going to have all of our shows. We have one coming up on domestic violence. We have one coming up on milk banks, milk banking and donor milk, some really, really great episodes. So make sure that you guys check out my event page and see what we got going on, because it's going to be good, good, good stuff coming up. There was a question. There's one more that I definitely wanted to address, and I'm looking for it right now. Where is it? It was, oh, here it is. Romana. She said, I had a C-section in September of 2016. Is it possible to go through normal delivery next? Yes, absolutely, Romana. Okay. You know, what that is called is a VBAC, vaginal birth after cesarean, and it is definitely doable. And especially if you've had a horizontal incision, like a low transverse incision, that means across here, low down, those, you know, and you want to make sure that you have that, you want to make sure that you check with your doctor, because sometimes the incision can be in a different direction on the uterus and a different direction on the abdomen, and you want to make sure they're both low down. But if that's the case, which the majority of them are, you can absolutely have a VBAC. I did so many VBACs in my practice. So many patients came to me because they had a C-section the first time. They really wanted to have a vaginal birth the second time, and VBACs are quite safe. You know, even though we hear scary stories, and sometimes you'll hear things like, oh, once you've had a C-section, you have to have a C-section again. That is absolutely not the case for most people. And VBACs are usually quite successful as well. The risks are really not that, it's like less than 1% risk, which is actually less than having a repeat C-section. The risks of having surgery, which is, yeah, exactly, Kate. Exactly. You're right on it, Kate. The risks of having a repeat C-section are higher than the risks of a vaginal birth after cesarean. And so it's definitely worth going for it. There's so many reasons to try. The recovery is so much easier and better, and it's just better for the baby. It's better for you. We had a show a couple months ago about the microbiome and just the idea of delivering vaginally and how important that is to seed the baby with all the bacteria that they get from going through the birth canal. And so there's just, and if you're wanting a VBAC and you are talking to your practitioner or your doctor and they're saying no, and the only reason is because you had a previous C-section, it is really time to go seek out someone else and get a second opinion. These are their recommendations. We know the risks are much lower, and it is very, very possible for you. Mm-hmm. So Pat's saying her VBAC was quick, 3 contractions and you had the baby. Mm-hmm. Yeah. It's, I love, and I can remember so many times in my practice where I had moms. I had this one mom, I'll never forget her. This has to be already like 17 years ago. And I still can remember the exact moment. She had come to me, she was 37 weeks pregnant. And, she had a C-section with her first, and she really wanted to have a vaginal delivery. And she was seeing this doctor. She was down in Southern New Jersey. And I remember she asked him multiple times during the pregnancy, I want to have a VBAC. And he kept saying, yes, yes, yes. And it was all the way to the point where she was 3 weeks away from her due date. She said, we really need to talk about this. And he said, it's a big baby. You're having another C-section. And I just remember getting a call from her and saying, is it too late? Like I'm like 37 weeks, 38 weeks. Is it too late to transfer, to come to you and have this baby vaginally? And my answer was always, if the baby's not out, it's not too late. And so she drove up to see me, and she labored most of her labor in the shower. I remember that. And then at one point she said, I feel like I need to push. She came out. She had this beautiful delivery, not one stitch, not one tear. But the thing that was so amazing is when she delivered and I handed her her baby, the look on her face and the first words out of her mouth were, oh my God, I did this. I did this. And, that feeling of feeling so empowered, a feeling that I know will stick with her the rest of her life, of feeling like, I've been through this and I accomplished what I wanted to accomplish. And there is nothing more joyous than to feel like, and whether you've had a C-section or a vaginal delivery, just giving birth, we are all amazing, no matter how that happens. But that feeling of like, I did this. I don't know. I had that feeling too when I gave birth. It was just that feeling of, wow, can't believe I just did this. So yes. And the baby was an average size too. Yeah. Yeah, it's true. Let's put it this way. People can deliver big babies. All right. So most times, unless you have some, medical condition like uncontrolled diabetes or something that is beyond the norm, your body is just not going to grow a baby that's too big for you to deliver. So it doesn't make sense for that to happen. And most times that does not happen. So we all need that chance to be able to birth until we can't. And then if we can't, we want to make sure that we have all the medical care available to us, just like the situation you had with your second twin, Laura. Right?
Right. Labor is good for the baby too. A lot of people don't. You think, oh, well, it's so much easier just to schedule a C-section and go in. But the labor is so important for the baby because it stimulates the nervous system. It helps strengthen the muscles. It helps dilate the lungs so that the baby can breathe, when the baby comes out. There's so many benefits to actually going through labor. And for the mom too, there's a lot of things happening, in your body during that time that have to happen in order to complete the process. So it's important for the baby and the mom.
Even if you're laboring and then wind up having a C-section, it's still important.
Right.
That labor is still important. So yeah, absolutely. Oh my goodness. So it's 10 o'clock already here on the East Coast. Our entire hour went by already. Again, tonight, our sponsors are Back Buddy and also Bloom Life. And if you want to win the prizes tonight, please love this post. You've been commenting, but go ahead and comment here. Tell me what you love about either brands or product, and make sure that you register, and then we're going to pick 2 winners. What a great night. I hope you guys all got a lot of really good information. Please make sure that you're paying attention to the events. I haven't put them all up yet, so they will be, because everybody's going to say, I don't see them. I don't see them. So make sure that you look. By the end of the week, I'll have at least all the different topics up for the next 8 weeks, so that you guys can sign up for reminders. We have some really, really good shows. And Laura, thank you so much for joining me again and being here with us. It was fabulous.
I'm always happy to be here. Thanks for having me.
Absolutely. And to everybody in the chat room, I love you so much. Have a wonderful, wonderful night. And when will I see you again? I guess it will be on Wednesday, next Wednesday. Okay. So keep posting, look for the events, post your questions for me in advance, and have a wonderful night. All right. Good night, everyone. Mwah. Bye. Bye.